Welcome to Dr. Kannan Pugazhendi's channel. Today we are going to talk about mental health. Huh? What is this guy, a sports doctor, talking about mental health? Has he anything to do with this? Who else? If I deal with sports medicine and sports stars, athletes, celebrities, all of them come with the ups and lows. It is never the same. It's not a plateau. It's never a flat. All of us are on a high and a low. On a high, no one cares. But when it goes low, we don't know whether we'll come up again, whether we are going to be drowned fully. And those are the times where we don't know the recovery is possible or not. Common impression is that any strong man should have a very good mental strength, or a person appearing weak may not have a mental strength. Now, when I deal with athletes, I am dealing with an athlete who is anxious about improving performance. I am dealing with people who are afraid that they may not perform. Like, I am in front of the camera. Will I be able to tell something that can capture your imagination, or I would be criticized? So what will happen? I have already shrunk myself and I'm not able to go further. And I'm waiting for you to give me comments about what are the errors I made. I have actually shrunk my potentials. So to open up, to flower, to blossom, it requires an absolute confidence. So all of us do not have that confidence in the same ebb that we can possess moment to moment. Yeah, moment to moment. Because it fluctuates. It fluctuates because of the environment. And those who are called as saints are guys who do not get to be bothered about what's happening around. So we are the normal human beings who have to be moving with the tide, and thereby the tide can take us up and down. So all our question is, can we maintain this harmony without hitting a doctor's clinic for diagnosis that can be anxiety oriented, depression oriented, or schizophrenia? I am not going to enter into an area which is a psychiatrist's domain as a disease being named. I don't. I refer them and I don't have to deal with them. But when it comes to people who appear normal and do have doubts whether they can do the job well or do their performance well in any form of physical endeavor, when it comes to training, all of us have one problem. Whether I train at 100% every time and thereby see that I push my limits. But when it comes to athletics and sports training, 60 to 70% of the capacity is what is explored, and wherein the accuracy component is worked. Say, like, you're going to pitch the ball at that particular point, you keep on pitching at 60-70% capacity and vary that to 100 on and off. Say, like in bowling or serving in tennis, you go on working at it, not at the same 100%. It's not possible. It's like asking a Usain Bolt run, every run at the best of his capacity. No, none of us can be. So we need to understand that we are waiting for the last explosion to ensure that we do the best then. So otherwise, they're all mediocre. In fact, mediocres are normal. When they come to the superior or phenomenal performance, they are abnormal. Actually, most of the athletes, champions are abnormal. We are the normal. See, there are three kinds of people. Those who watch it happen, those who make it happen, those who wonder what happened. So the make it happen category are how many? Think about it. Most of us watch it happen. And if we are not able to accept somebody's victory, not able to take into consideration, oh, this guy got there, huh? I couldn't get there, he got there, how is it possible? There must be some other means by which he got there. So the qualities that we are endowed with are constantly threatened and affected. So it requires phenomenal introspection. The introspection that we require to understand ourselves more than understanding somebody else. So when athletes come up with their problems of, I want to conquer, I want to do this, the conquering happens inside you, not outside you. This is a phenomenal revelation to all of us. We want to be a champion provided you can conquer your fear, your anger, your anxiety, your adoration, your hatred, joy. These are the 7 emotions that seems to churn us around. So when the churning happens inside us, the possibility of some of them taking us out of the normal routine and keep us away from returning. I never knew that we are out of the normal routine. And those are the people, when I meet them, they didn't realize that these changes that has happened in the last few months has made them a patient and meeting me for a consultation for pain. So then I asked them, keep on asking them questions. Anything that you did, maybe I was running faster, I was jumping, I was doing this addition, will be a common, I had a fall. No, it is not the fall. It is the consequences of the fall that carries more changes in the mind, the fear. Will I be able to get back? If I fall now, will I do that in the real performance? All these are questions. So how do we come back again to put ourselves together? We need to put ourselves together. That requires an awareness that you have changed from the normal. Without that, we cannot begin. Somebody has to point out to you, or you are aware of it on your own. And that is going to be a beginning. Now, how do we know that this has happened? One, it can affect your food intake. That is, we call that as appetite. Hunger and appetite are different. Common impression that I'm hungry. But when I eat, within a short time I don't feel like eating. Or when I eat, whatever I used to like, now it doesn't seem to tempt me anymore. This is what I call as appetite. And appetite is something you finished your food, still one jamun and ice cream are there, you want to eat again. That is appetite. So don't think appetite means hunger. Don't mix up these two. Your appetite is altered. They'll say, sir, he likes laddu a lot, sir. Whenever you give him laddu, he will not bother whether he's hungry or not. He doesn't like now. Sir, when that person comes, he's smiling, he's happy. Now he doesn't care. So these kind of things where relationships that were very vital doesn't mean anything now. Even a boyfriend or a girlfriend that come in that day don't seem to be enticing. The reason is I have something else working. Like I like to wear clothes. They don't bother now. They wear any dirty clothes to move around. Before they'll be very particular about the shoe wear, the socks they wear. This is how I'll dress up. Suddenly this person doesn't bother. And they lost weight. Their performance is stagnating. And they also find that the drive to continue to do what they want to do is suddenly lacking. They are not able to sleep well. The sleep pattern is altered. They are turning in the bed, getting tired and then sleeping. They are not able to dip deep into their sleep, and they are not refreshed when they get up. So when they are not able to see this, again another important, sleep is very, very important for us to get to be normal. If you are not sleeping in the right time, the right duration, the right amount of depth, and your recovery is inadequate, the next day is another day which is going to be challenging. So these are subtle changes that needs to be worked. Your heart rate is higher, your resting heart rate is higher, your breath rate is higher. You will find your BP can also be altered. These are clinical signs that a doctor may pick up but can't fix what is the reason. There are two extremes. Those who are hyper and agitated, aggressive, and those who are on a lower end, absolutely depressed. So we need to handle this in a different way. These are the people who may require to look back and understand Either their friends do that and then tell them, okay, there's something wrong with you, or they have to have an introspection. So you may have to talk to this person and understand what really bothers them. And in that, if they have understood, the first thing is to ensure whatever work that they believe they're doing, like athletic training, what they ask them to do? Stop your training and get away from that. Go and do something different. If you are, say, you are a tennis player or you're a shuttle player, you get out of the tennis court, go out of the shuttle court, ensure you go and do something different, totally different. You be in the swimming pool or go for some kind of trekking, be away from that space. Do something different. You can take a vacation. You don't do that same thing which is forcing you to be in a depression, forcing you to change your orientation towards that performance. So you are going to understand this at this point and ensure that you can make changes, or people around you, because they have understood now, and this guy is not improving, how to sort of work with this. So we call that as overreaching. In sports medicine, we have calling it overreaching and overtraining. So whenever we are able to see, even in the general population, that the same thing that happens as overreaching. So the overreaching is totally recoverable within about 3 weeks time, maximum month. But if you move into overtraining, that is, say you have already gone past this period, then it's going to be not less than a year and more. So in fact, some of them never recover. The reason is it's too long past the capacity to recover. In that, yoga will be a major game changer. In that, not the asanas alone. It is about the meditation, the higher levels of yoga, where you talk about pratyahara, dharana, dhyana, samadhi. So the yoga that India has given to the world must be incorporated in almost every aspect of human endeavor to ensure that we can make a difference through the science that has existed thousands of years. Meditation cleanses your whole slate and ensures that the mind is expunged about thoughts that were causing fear, that were causing anxiety, that were creating doubts in your mind on your capacity. All this can be altered. Focus on your breathing. It is a bit difficult to start with. So first observe the number of breaths you make. Do you know how many breaths you make on a day-to-day basis? A normal breathing rate, 16 breaths per minute is a normal breath rate. And whenever you are crossing 20, you say it is tachypnea. You are breathing higher than the required amount. And when we are cutting down the number of breaths, we are cutting down the amount of the mental activity. Just follow the breath, your inhalation, your exhalation. Your inhalation, your exhalation. Follow. Continue for 1 minute and then realize you can slow down the breath at least 4 breaths only per minute. That is, your inhalation, exhalation gone for 15 seconds, 4 breaths are possible. And once you are able to achieve that, keep that for 5 minutes, then 10 minutes. Then you realize you can recover from any form of mental aberrations. I wouldn't say health aberrations. So those who are aggressive, we are trying to reduce the continuous bombardment of impulses on the brain. So you need to understand, when we control the breath, we can control the mind and reach some of them may call it mindfulness or no mind state. So when you start, let us take baby steps again, that you can begin with observing your breath and then reducing the number of breaths literally over a period of time. So whether you exercise or you do yoga, you have to breathe deeper. So you need to move and heal. If you don't move, it can force you to move in a direction that you may never enjoy. So start to move. Exercise, yoga, tai chi, any form of dance that can make you sing inside you and that can make your breath deeper, that can take you out of any form of depression or aggression. On a World Mental Health Day, you can make the change. Vanakkam.